your blood glucose and the pressure. So through some activities, actually utilize the internet, big data with a lot of other cutting-edge technologies. This bring benefit and quite professional and convenient health services. I believe this is also save a lot of time and energy for the people to go to the hospital. So talk about how exactly the rooms look like. Today with me is special guest, the director Zhou Feng. So he will talk more about a bigger picture of the smart health house. So this is Dapuqiao compound. So this is a pilot project in Shanghai, and we will have 80 smart health houses will be built by the end of 2019, and 10 out of these 80 will be located in my community. So talk about the Dapuqiao. This area is a very friendly environment with a population of 65,000. So as you just mentioned at the opening, we talk about for the last mile, we would like to give the golden key of health to our people living here. So let's look at exactly what we can have and what is the healthy report looks like. So this is a big screen. You can see right now all the health cloud data all upload to this platform. So look at the whole platform. There are registration around the 4.5 million users, and this is the rough idea about the whole platform. Right now we have 243 the healthy service centers. So this is to give you a bigger picture about Shanghai. That this is what we call the healthy cloud. So all these healthy indicators all upload to this cloud, and look at that. This is my area. It's a Huangpu area, Huangpu district, and this is the timely data update in a prompt manner. And we talk about the population with diabetes, with the population with the high blood pressure. We talk about the chronic care management is so important because the taking up the 24% of the total death. So we talk about the chronic disease really need a long time monitor. So that is also why we encourage the residents to come into our smart health house to do this test. So of course, like people also buy some of the equipment back home, but that sometimes they don't know how to operate, and sometimes the way they operate is not in the correct manner. So we also encourage them to come to our house so we can provide more precise the measurement. So this is the updated information. This is the data from these smart health house. So and or the a social security card. Just scan your card and you can get 11 healthy indicators like your weight, your height, the body temperature, heart rate, blood pressure, the body fat, WHR. And we look at right now, we're testing the body fat. And also you can test your blood glucose, UA, total cholesterol. So overall, there are 11 indicators you can get. So the lady, she's so familiar and she can operate it by herself. So right now, test her body temperature. And you can see it's just very fast. Just one click, and we can get a number. So just within 2 seconds. And we also can test the blood pressure. So for the when you're testing the blood pressure, you're not allowed to speak because that will fluctuate your number. And we talk about the and also, of course, the doctors, when you go to the hospital, they will see your record, your historical record. And that's not only one number, actually, that's a trend. That's a big curve, I believe. That's very helpful. So it's also better you have something to base on to manage your blood pressure. So for her age, I believe the number we got is quite okay. And we talk about the oxygen, the degree of blood oxygen saturation. The 95% is okay level, and the lady is 99%, so the number is quite good. So we can talk about her healthy condition is very good. So normally the number is around the 98% to 100%, but for the patients with the emphysema, then the body temperature, the oxygen level will be a little bit lower. So we talk about the whole equipment is totally can be a self manageable, and we also have the staff here to help you to get all the numbers and the tests. And we actually will all record the numbers every time when they have the test here. And this is blood sampling, and you can see it's very simple and fast. So wait 15 seconds, you will very soon know the final result. And we get the number, the UA number. So this UA number, the uric acid number, is what we want to see. And another number we want to get is the WHR, waist hip rate. And we talk about the diet structure actually is changing. A lot of people, they have quite poor WHR number. So it's want to once again stress the importance of this WHR number. So we will also upload the number to the computer, and the computer will give us the number. So they will get the calculation, and that's also help us to do the overall evaluation of the health condition. So later on, we will see her whole report. So right now you can look at the indicators we get. Overall, the number is okay, healthy. You look at the weight, height, but you look at the WHR a little bit higher. The UA is at 0.34, it's okay. But the WHR, you need to pay a little bit attention to this. So please keep it. And later on, you go to the hospital, you also can give this to your doctor. And you also can keep it as a record, and you also can do some comparison. So maybe half a year later, you can see whether the number is improving or getting worse. So this is something you base on. So this is your first time to test this house? So this is not my first time. Because this is just so close to my house. So I can see if, like today, there's not a lot of people here. So I come here to do my test. And it saves a lot of time and energy, so convenient. So I think the government really pay attention and deliver this tangible benefit to us. So you're very concerned about your health. You look at a little bit oversized. So the sometimes it's caused the heart disease and also the fatty liver. So I sometimes take time to come here to take the EDG. So also can do EDG here, but right now the ECG. For ECG, I'm also will be here. Sometimes feel the higher number of a heart rate, so a heartbeat a little bit faster. But look at right now the blood pressure is okay in a healthy range. But still, the number we talk about is quite high. So I have the family disease in the blood pressure. So we also give the report. This is the complex report. So you can look at the blood pressure. We said it's okay, but it's quite common to the highest level. And look at the DBP, it's okay. And also do the comparison so we can see the curve. That's the previous 2 times we did here. And the curve a little bit going up is okay because it's the seasonal impact, because right now the temperature is a little bit higher. And look at this number, it's okay, so no big fluctuation. So this is the blood oxygen saturation. And also look at the whole body healthy access. We talk a little bit oversized, overweight. And we also look at the body fat is also higher than the maximum number of health. So we look at the different, like the muscle analysis. Right now she is okay. And we also had the curve right before 25. Right now it's 35. That's the body fat. A little bit going up. So it's a good thing. It's like we give you a curve because sometimes it's quite hard to understand all these numbers. But you look at the curve, you know it's a curve going up, going down. Then it's really call our attention. And we also have the doctors at our community clinic. So the doctor will also give some suggestions. So this is a quite intact report. So believe the residents actually they also can do the early intervention based on the healthy report. So they can also take the early actions to cure the disease. So we talk about hospitals that really take time, but here look it's so convenient. If you have time, just come here and you know exactly your body condition. So this is very convenient. I really think, especially for my age, like the elderly people, is so convenient and so helpful. So we talk about besides these 11 indicators, we also have some other games, activities that you can know your body condition. So this is all the equipment we need to know. Like we also use, like we talk about that the grip strength, the vital capability. We also have the vertical jumping, sit and reach, and we talk about all these not only for the elderly people, also for the adults. Like the vertical jumping actually is not good for the people above 60 years old, and for these safety concern. And we also can do a round of all these equipment. So know the sick. So as long as you got your ID card with you, this is your number. So at our cloud or the app, you can know all these numbers, and they will be all uploaded to the app. So please bring your ID card or the Social Security card. And first we'll get the grip strands. So we also have the demonstration on the screen. So just follow what it shows on the screen. It's very easy. We have the instruction. So we also the local sports authorities also touch great importance, and we talk about the smart healthy house. We will also get the number related to sports and their capacity of doing sports. And then we'll also test the vital capacity. So look at the demonstration, the instructions as shown on the screen. So how long does it take for the whole round? Of course, you do not need to really test every day. So every 3 months to half a year. So it's better we suggest to do one round of tests to know your body condition. So normally there should not be a big fluctuation. Of course, where age increasing, you will see some fluctuation. And here we look at the reaction. So basically you will see this is quite popular because for the elderly people they think it's quite fun, but also can test their reaction. It's like a game. So just touch the right light. So we test twice and we get the average number. So for this equipment, there are 3 activities: grip, strength, vital capacity, and the reaction. And then we move to the next equipment. So we talk about the numbers that can be improved by exercising, of course. We talk about the chronic disease that's related to the less exercise. So that's also we suggest our working population, our elderly people, please work out twice or 3 times per week. So to the a medium to quite high intense activities. So I also suggest to get this round of tests every half year. And this is a test for sit and reach to evaluate your ligament. So I believe the lady right now, I think she also have doing some daily activities. So for her age, I believe the number is okay. Of course, we will give her the numbers for her age group. So you have a rough idea. And we also have for the safety concerns, and we also have the equipment that's for different ages. I look at the sit up or the trunk extension. For some activities, it's not allowed for the people age above 60 years old. And we also look at this as testing her balance capacity. So this is quite fun, a lot of interesting activities. So we're finished with this equipment and we move on to the next. And this is for the vertical jump and the sit up. Of course, sit up for ladies and the push up for gentlemen. So look at the jumping capability. So the infrared ray will help us to capture the movement. And the sit up will around 1 minute. So look at all the IR equipment. So basically that will help us to capture the movement, and that we will see the results of her equipment. So we're counting the numbers. And also within 1 minute, we will see how many sit-ups she finished. And then we will calculate her capability. Of course, we don't want to go extreme, just based on your own capacity. So she finished 13 sit-ups within 1 minute. So just according to your abilities, we don't want to really push yourself to extreme. And this is to test the climbing stairs, the steps. So for this one, it lasts 3 minutes. So what we talk about, actually, we need to get a complex look on your whole body, because this is also reflect your body condition, your body abilities. So look at this will test her the heart rate. And we have a lower step. And we also have a higher step. So the lower step for ladies. So for the gentlemen, we will suggest to do the test at a higher step. And we also have a heart rate bracelet with us, and we also compare to the resting heart rate. So we got a comparison. So you look at her right now is 110. So of course what we want to get is a very small differences between the heart rate in sports and the resting heart rate. So like athletes, there's no difference for them in terms of heart rate when they're resting or doing sports. So for this test, it's a little bit longer. They need to do this test for 3 minutes and also need to sit and rest for 3 minutes. And this is the report when you finish all round of all these. So you look at the vital capacity, the grip strength, vertical jumping, sit and reach. So for of course, based on your different age, you got different scores. And also for the people age above 60s, you can, of course, do all these activities. So the numbers, the scores fluctuate based on your age group. So we will get her report after the lady finish all these tests. And look at this report, grip strength. Of course, for the ladies, the grip strength cannot compare to the men's. But we also do the comparison according to her same age group. And for the final reports, so after the lady finish all these activities, we need to wait for 6 minutes and then to get the report. So basically, we give you a bigger picture to say that for different items, so for your same age group, what's the average number? A red number means poor, the yellow means okay, the green means good. So we also identify different numbers, conditions with different colors. So you need to rest for 3 minutes. Right now, the heart rate is around 123, I believe, 121. Of course, what we want to get is the resting heart rate should be so close to the heart rate when you're doing sports. So we want to improve the blood oxygen ability. So by doing sports, doing exercise, this can be improved. And we also have the community service center, and we also have every week to give the exercise to the elderly people. So we also get them to work out. So we talk about that these data actually will upload to the healthy data cloud. So what is the healthy cloud? This is the healthcare cloud. So either you tap in your phone number or scan your ID card. So you look at this is the a terminal of the healthy care cloud. You have your profile and also can book an appointment and also can book appointment with the doctors. So we look at all the test numbers. So you click here and we look at your number today and also your historic record. So this is the number that we got today and also can see your historical numbers. And then we get a momentum, so you know exactly the curve is going up or going down. And look at this the physique condition, basically your body condition when doing sports. So we also give you a suggestions. So we talk about we not only have the report in paper, we also have these electronic ones, and also your doctors can also get all these numbers through the cloud. And what else we can have? And we can check here. You can book an appointment. So you have an app, and then you look at this is a class 3, class 2, class 1 hospitals. So you can get a registration or book an appointment with the doctor. So we talk about after we receive a report here. So through B-Chat platform, of course, we also can book an appointment, but actually we have a specialist here to tell me that which department you should go to or which hospitals you should go to, right? Yes, in Shanghai, we have the 1+1+1 program. So for the residents, you can choose the service. You can choose the family doctors. You can book appointment and also have the contract with your family doctor. Because sometimes we don't know who we should go to, which hospital we should go to. But when you have your family doctors for the very basic disease, and you just consult them with your family doctor or a community clinic. And also our family doctor also can make the suggestions to the patient to say which department, which hospital you should go to. So that's a 1+1+1 means a family doctor, a community healthy house or a community health service center. Another one is the hospital. So you can also choose this based that where your phone. So it's not really to say you should go to the hospital every time because you really wait for a long time to get the appointment with the doctors. Actually, these kind of the activities can be done in the community clinic or this kind of a service house, and everything is for free as long as you have a social security card in Shanghai. And then you can have all these service. And your family doctors also know exactly from A to Z of your health conditions, so they can give a very precise, accurate suggestions to you. So I believe we have the family doctors. Yes, we have around 243 be a community service clinic, and that's all covered with family doctors. So our community residents can enjoy this quite quality healthy care service. So we talk about a 1+1+1 program actually rolled out for many years already. But still, we need to do more education to include more people to join our program and signed a contract with the family doctor because this is so helpful. And you can manage your health conditions on a regular basis. So don't go to the hospital when it's too late and still need to wait a long queue to get a registration appointment with the doctor in the hospital. So just come here to the community service centers and we have the family doctors waiting you here and we can get your health conditions. And especially for the elderly people, sometimes they don't know how to really operate these kind of apps. So we also help them to download the apps, and if they bring their ID card, we also can help them to check all these conditions, all the like booking appointment with the doctors at our smart health house. And we also invite the doctors to come here. So at the beginning of this year, China also released a big program talk about the 2030 Healthy China. So we talk about right now for the clinic, especially the community clinic, should be healthcare management driven. We talk about the last mile. This the healthcare service. So we talk about we want to provide these kind of facilities to the community residents to get a early intervention to manage their healthcare. So talk about the app. We talk about we can book appointment with the hospitals, with the doctors, and also the family doctors. You can check your historical record of your health condition. This is a helping hand. Think in this way. This is a very helpful assistant. So all your healthy care information, you all can find it here. So talk about the smart health houses. Why we have this? So talk about the Daptel area, the community actually we have quite a large population of elderly people. So we talk about right now we come to a quite in the population intensive situation. So talk about 40% of the population here in Daptel community are elderly people. So this ratio is quite high. And you also look at this area, we also have a lot of office buildings. So which also means we have quite a large number of working population. So you look at this is a comprehensive service center for elders. This is the Daptel community. And this is also the demonstration area representing Huangpu district. And you look at this big screen. You can see this is also can bring more facilities and benefits to our elderly people. Also can do a lot of other services, not only limited to the healthcare and for the preferential conditions like the healthcare, social care, and also the activities. Also can do the application here. So we look at it, there are a lot of things like the elderly people can enjoy, and I believe can see this is our all the service dedicated for the elderly people, and also can representing the residents in Daptel community and do this application of service. So we talk about actually this is more or less the same model rolled out in different communities in Shanghai, right? Yes. So talk about the 10 communities in the Huangpu district, and we also connect it. So at this big screen, you also can check other community centers. And look at this side. This is our platform of Huangpu area. So this is a bigger picture of right now. You look at what kind of a service you would like to get. This gives you a bigger picture of what we can provide. And of course, we also have daycare service. There are a lot of service, or we talk about the sub center, provide more service to our elderly population. And also we have camera to capture the live pictures and 360-degree. So this is live footage. And also can check the different areas like the kitchen, canteen. And let's go to the second floor. Oh, look at this, it's really detail driven, right? Look at the number. This is the number of service orders or the number representing. So this is a monthly number. So part of the service is for free, and some charge only a little. Of course, it's the experience-driven service. So a service provided to our community residents or the residents in Shanghai. So this is our monthly number. This is actually, I can say, our service is quite popular among our elderly friends. You can see every details here is so detail driven and really provide a care to our elderly people. So really elderly friendly environment here. So also can have this for our elderly people to climb to the second floor. So coming up to our second floor, what do we have here? So we talk about the whole area is around 700 square meters. So for the upper level is around 400 square meters. So it just I finish all the decorations by the end of last year, and this also showcase that what we can have. So we talk about the for the patient with diabetes. So our family doctors will show you like you want to do the fried egg with tomatoes. You know how many tomatoes you need to have. And basically we do some demonstration to our family members of diabetes patients. So actually through this kind of the involvement, our patients, our residents, community residents know exactly how many calories they can take in. So we talk about this is really intuition. So we want to bring everything visualized. So we talk about how many calories. This doesn't make much sense, but we give you this kind of spoon to say you need to have 1 spoon of this. So that make more sense. So doctor not just basically have one-man talk. We want to bring everything, visualize, make more sense to our elderly people. And we also have other classes, other activities provided to our community residents. So like the calligraphy activities, and also it's a very nice place for our elderly people to come here to talk to each other. And we also have the therapists coming here to give the classes to the family members of the cognitive disorder patients. And we also have activities to tell who may have the potential risk of cognitive disorder. And if we want to do some activities, want to do some exercise, we also have these facilities here. So for our elderly people, they also can come here to do some workout. Very nice workout for the elderly people. Not so intense, but can build up their body strength. So they can get their numbers downstairs, right? And we would also give them the suggestion to say, you can come here to do this kind of activities at our second floor. So you can also to train your muscles, your strength, of course, step by step. And this area is more for the mental stress. So want to have the quite stressful. So we also have the doctors here to talk to the doctors. And also, of course, if you want to have a chat with the doctors, you also need to book appointments. Then we will invite the doctors to here. And also we have, this is a daycare area. So we can see we have some massage area. You can see this is the most popular areas. So let's make an interview. So how do you feel? You normally come here every day. So I think that's really help you to improve your health. So how you know this place? So I also live in this compound. So my friend actually suggested this place to me. So to come here around 20 minutes to here, it's really help him. So he's normally come here every day. So this is the massage area. So very popular. So this is really massage their backbone. So quite sore at the back or the waist. So this is a massage chair to really help them to improve and also relax. And this is also the area for rehabilitation. So you can see from every detail reflects the care given to the elderly people. And we talk about these areas actually initiated by the end of last year, and talk about this this is the complicated elderly service care. And right now you can find in Shanghai, every community, they will have this kind of a service center. And we built and put in the operation is July 2018. So of course, based on the requirement of elderly people, you can see at the first floor, we have all these healthcare condition information, so they can, through different tests, they can get their numbers. And they also can use our service like the Daycare. We also have the cafeteria. So we have a lot of facilities here to provide service to elderly people, and you can check all available service also at the front desk. And at our second floor, you can see a lot of different facilities. Of course, as all designated for elderly people. They will not get hurt or injured when they're doing exercise here. This is different from the normal machine in gym. So this is the you can control the resistive. So basically, the resistance is based on the strength of the person using the machine. So this is so different from the normal equipment you see in the gym. So you can try on a little bit. So this is also your first time to try out? So for this one, basically you can see this for the coordination of your arms and legs. And for this one, the yellow ones, if you push harder, and that also increase the level of resistance. So that help to protect our elderly people. You can see it's got back very, very slowly. It's like the gym, it just quickly come back and will hurt our elderly people. We talk about this is the equipment actually the design for elderly people. So for different equipment that's trained, the upper body, the lower body. So how you get more and more residents know we have these facilities, and we can, you just go one household to another. We have the official WeChat account, and we also work with other related departments and authorities. So the elderly people will first come to our first floor, know exactly what kind of service we provide, and then they will come back on a regular basis. I believe that is why we have this smart health house here. So they find their issues at the first floor, and then they will come back to train to get improved at our second floor. So every morning from 7 to 9, we have also the morning session to check their body condition. So as long as our elderly people come once, they will know exactly what kind of the service we provide and what kind of service or benefit they can enjoy. And we have quite a full schedule, so you can check this is the class we have. You can see we have different classes like the dancing, and we also have the backbone exercise. And we also have the therapy session for the TCM, like the cupping. So or the Moxie Boston. So these or the TCM treatment. So all these you are seeing here is for free. So look at the bakery activities. We also have the singing, dancing, different activities all here. So for different occasions, for different holidays, we all have special events for elderly people. So we also have a VR glasses to provide you the service. So like let's say this. For one elderly person that come here to want to know what kind of a service you provide here at the service center, we provide this VR glass, so you will let your person really in this scenario, so you know exactly how everything look like and what kind of service you can enjoy. So we talk about nursing service. Of course, we will first do the evaluation. So we talk about the nursing house. We basically is targeting the elderly people with a second to a third level. So basically, all these levels based on our evaluation. So we talk about the for elderly people. This is kind of like a hotel, right? You can sleep over. It's different from nursing house. So this is for short term, for the like 2 to 3 months maximum. So we talk about a nursing house actually in a quite remote place. But we talk about this kind of the nursing activity facilities is just located around the community. So talk about their friends, their neighbors, all here. So we talk about they not feel like they're alone. So basically, this kind of a short time, a nursing place. So we provide nursing service to the elderly people, and also receive the therapy and treatment in this service house. So we talk about the elderly people that they have difficulties to cook for themselves, and they don't have other people to help them to cook, and they also can come to our service house. So we have how many this kind of service house? So we have one this house in each community. So this is the a house community, right? So we have the activity room. You look at the curtain, and this is single room. And we also have this open area at the second floor. And this is the bathroom, the shower room. You can see all the facilities, very elderly people friendly environment. And we also have a different activity room and this double room. So also can wear VR glasses, so know exactly what we provide. Like exactly in person, you are in our service house. You do not need to really go to that place to know exactly how everything look like. Just here, you just visit here, and we bring you the full look, a live picture of our service house. So we need to book in advance. Yes. So we will do a evaluation if we think they meet our standards, and then we send a contract agreement with the elderly people. If it's a full house, they need to wait in a queue. So how does it charge? It's less than 4,000 RMB, affordable price per month. And also we look at the activities, the picture of previous activities. Thank you so much. I believe we have a quite detail-driven visit today to look at. This is in Shanghai. So we talk about elderly people in Shanghai. We have quite a professional place to manage their healthcare. And also in this area, the worker can receive quite the care management and also get their body exercised. So this is a closer look to this smart house. And we talk about by the end of this year, we'll have 80 smart health houses will be built. So we talk about only available in the community compound and also will locate in the office buildings. We talk about we're not only targeting the elderly people, actually by the end of the day, want to cover the full age group. That's for this edition of the live stream. Take care.